This video we will discuss about Pemphigus. So Pemphigus term is derived from Pemphigus, which means a blister or a bubble. Now coming on to the definition, it is an autoimmune intraepithelial blistering disease which affects the skin and mucous membrane, causing the degeneration of basal keratinocytes and is mediated by autoantibodies. Now coming on to the pathogenesis. In pathogenesis, what we see is, since it is autoimmune, so the autoantibodies, they are directed against desmoglin 1 and desmoglin 3. Now this leads to an inhibition of the molecular interaction which is responsible for cell adhesion. This leads to an intraepithelial split, which is also called as suprabasilar split. Now coming on to the epidemiology, it occurs in the age of 50 to 60 years, and it does not show any predilection in the gender. It is commonly found in male and females both. In sites, it occurs usually in the buccal mucosa in the tongue. Now coming on to the clinical presentation. First of all, what we see is, we see the appearance of bullae. Now these bullae are seen to contain a thin watery fluid which further converts into the serosanguinous or a purulent fluid. Now, a very characteristic sign is the Nikolsky sign. What we see is, if we apply a pressure on one side of the lesion, we see that the epithelium falls off. This occurs because of the perivascular edema which occurs in the intradermal and the dermal junction, basically the epidermal and the dermal junction, due to which the epithelium slides off. Now, when these bullae will rupture, they will leave a eroded area. Coming on to the oral manifestations. In oral manifestations, first of all, since it affects both the mucous membrane as well as the skin, so basically the mucous membrane involvement is more. It may occur 1 month prior to the cutaneous lesions. In cutaneous lesions, what we see is, these are rare. There are intact bullae which are present in the oral cavity. Now these basically occur in the gingival and the buccal or the palatine regions. Now they extend peripherally and they shed the epithelium. Now they can further affect the cervix or the larynx and cause the hoarseness of the voice. Then they can affect the esophagus, then labia, vagina, urethra. Now there is a very commonly asked question, which is the Pemphigus vegetans. Now this occurs around in 40% of the population. It occurs during 40 years of age. What we see is, we see the presence of sulci and gyri pattern over the dorsum of the tongue. Now this is usually called by cerebriform tongue. Now it is of two patterns. One is the Newman pattern and one is the Halopio pattern. Now coming on to the histopathology. In histopathology, first of all, what we see is, we see the intraepithelial vesicle formation in suprabasilar layer. Now also we see that the basement membrane, it remains intact, also gives a tombstone appearance. Now a very characteristic feature of the Pemphigus vulgaris is the presence of the Zank cells. Now what are Zank cells? They are basically swollen or rounded cells which have degenerative changes, that is, they have enlarged nuclei and a hyperchromatic cytoplasm. Now the spinous layer, it will show acantholysis and there will be inflammatory cell infiltrate. Now in diagnostic criteria, first of all, in the histopathology, we will look for Zank cells. Then we will do direct immunofluorescence test. In immunofluorescence test, what we will see is the presence of IgG and C3 in the intercellular spaces, and then we will do the indirect immunofluorescence. In this, we will see the presence of the autoantibodies which are against the desmoglin. desmoglin 1 and 3. Now coming on to the treatment. In treatment, we give corticosteroids like prednisolone. First it is given in a peak dose and then it is given in the maintenance dose. Then we also give some immunosuppressive drugs because it is autoimmune. So immunosuppressive drugs like mycophenolate mofetil, also azathioprine. Then we can also give monoclonal antibodies against the target B lymphocytes like rituximab. Now, the patient can undergo complete remission resolution, but the patient will again show exacerbations and remissions. Now, coming on to the histopathology diagram, first of all, what we'll do is we'll make the basal layer in the form of a dome stone appearance. Then we will shade the inflammatory cell infiltrate area. Then we will form the split. Now these are the Zank cells. This is the intact suprabasal layer, inflammatory cell infiltrate. All right. Then this is the supravasal cleft. Now one thing to remember over here is that this gives a pattern which is called as chicken wire pattern. So this completes the Pemphigus. In next video we'll discuss about white sponge nevus.